Welcome to this 3D journey inside your body. Today, we'll explore a condition that affects millions worldwide, hypertension, or high blood pressure. But what exactly happens when your blood pressure rises beyond control? Let's find out.
Blood pressure is the force of blood pushing against the walls of your arteries. It's like water flowing through a pipe. If pressure gets too high, the pipe can be damaged. A normal blood pressure reading is around 120 over 80 millimeters of mercury. When it consistently stays higher, say above 140 over 90, we call it hypertension. There are two main types of hypertension: primary, which develops gradually with age or lifestyle, and secondary, which results from another medical condition like kidney or thyroid problems.
Hypertension is called the silent killer because it often shows no symptoms. Yet over time, it damages your heart, brain, kidneys, and eyes.
In the brain, high pressure can cause arteries to burst or clog, leading to a stroke. This can result in paralysis, memory loss, or even death. Your heart must work harder to pump blood, causing thickening of heart muscles. Over time, this can lead to heart failure or a heart attack. In your kidneys, high blood pressure damages tiny blood vessels, reducing their ability to filter waste, leading to kidney failure. Even your eyes aren't safe. Damaged vessels can cause blurred vision or blindness, a condition known as hypertensive retinopathy. The causes include unhealthy diet, too much salt, lack of exercise, stress, obesity, smoking, and excessive alcohol use.
Some people are more at risk: older adults, those with family history, diabetics, or people under constant stress.
You can't feel hypertension, so regular blood pressure checkups are essential. A simple test can save your life. Prevention is powerful. Exercise regularly. Eat fresh fruits and veggies. Reduce salt. Avoid smoking and stress, and maintain a healthy weight. If diagnosed, follow your doctor's advice strictly. Medication, diet, and routine monitoring can keep hypertension under control. Hypertension doesn't have to be deadly. With awareness, lifestyle changes, and medical care, you can lead a long, healthy life. Remember, prevention starts today.